Thank you very much, Bernard. I appreciate your enthusiasm and excitement. It's always a wonderful and refreshing thing to get our program started this way. For everyone, understand something. We're going to go a little bit long today because Dr. Prasad has an amazing presentation prepared for us today. So I'm warning you in advance. What you want to do is if there is someone that you know that should be on here, don't tell them about the recording. You need to get them on here right now because this presentation is phenomenal today. So you're really going to want to have to make sure that anybody that you care about hear this program today. Well, my name is Jonathan Jones, and it is my pleasure, my privilege to be your host and moderator for this afternoon. And I'm excited to present to you Dr. Prasad. But before we begin, we want to lay the foundation for our discussion by just sharing with you one brief testimonial. Some of you may have heard this already, but it lays the foundation for what we're going to be hearing from Dr. Prasad. Okay, so Nick, go ahead and share that testimonial for us.
I'm diabetic. My A1C was in the 12s, which if you're diabetic, that's not a good thing. I'm also a high blood pressure person. My blood pressure was out of sight. When I got introduced to this product by Bob and Kathy, I had to have spinal surgery, upper spine, lower spine. Wound up taking no pain meds.
We're twins.
Which I love that because I'm not a pain med guy anyway. My A1C, I took my test just the other day, is 5.7. Excuse me. The only thing I'm doing different is Micro Daily. Nothing else.
Wow.
So I gotta say, it does what they say. And if we don't share it with other folks, shame on us.
Pretty powerful. And it's amazing to see things like that happen, but it's exciting. And we're no longer surprised when we hear these things. But if you're here for the first time, you may be saying to yourself, how? What happened? Was it just a fluke? Was it a mix-up in the lab results that this gentleman had the results that he claimed that he has? No one really knows. And that's part of the reason why we always have to share with you something that everyone needs to know from the beginning. The FDA has not evaluated these comments. Everything that we're saying today is for information, education, and sometimes entertainment purposes only. What you're hearing, testimonials, purely anecdotal. What happens to one person may or may not happen to you. We strongly recommend that you seek the competent medical advice of professionals that you trust. Please don't do anything I say just because I say it. Dr. Prasad is not a medical doctor. Dr. Prasad is a scientist. I'm going to tell you a little bit about Dr. Prasad in just a moment. What we would like for you to do is to recognize that even Dr. Prasad is not making any medical claims, about the products that we're going to be talking about. These are formulations that he himself has personally formulated. He's a scientist, a brilliant scientist. This is the subject matter that we're going to be considering: prevention and improved treatment of diabetes. Specifically, role of a micronutrient mixture, collagen peptides, and probiotics. Now that's a mouthful, but it's nothing out of the mouth of this gentleman right here. You see, Dr. Prasad has a history that, in my personal opinion, excels all others, not because he is the most accomplished scientist in the world, but because he's accomplished in what matters, in my opinion, the most. Something that's going to make a real difference in the lives of people that I care about, people that you care about. This particular topic is very sensitive to me, and I believe that personally, everything that I've learned over the past 35, 40 years has brought me to this moment, to this day, to this presentation. When Dr. Prasad said, I've got some slides I'd like to share, I nearly died when I saw that email, because I've said, phenomenal. What we're going to learn now is going to be directly from the heart and the mind of the most brilliant person that I think exists on this subject of micronutrients as it relates to diabetes. Dr. Prasad is professor of University of Colorado School of Medicine for 30 years, director of vitamin and cancer research, former president of the International Society of Cancer and Nutrition, member of the British Society of Medicine, the world's first radiation biology PhD, awarded 7 US patents on micronutrients, discovered the anti-cancer potency of vitamin E succinate. Who knew that there was more than one type of vitamin E? Dr. Prasad did, and he figured out the one that happens to, oh, by the way, be cytotoxic to cancer cells. Discovered that butyric acid, the small fatty acid formed by fermentation of fibers in the gut, is an anti-cancer agent. If you're going to have some probiotics in your gut, you might as well have one that's, oh, by the way, dealing with cancer. What has he accomplished? What did Dr. Prasad do? He's the author or co-author of not 29 books, but 32 books. And I apologize that I have not updated that statement yet, but I will. It's 32 books. The latest of his books is on dementia and memory loss. He's been published more than 250 times in peer-reviewed publications. I had one doctor say to me, "You've lived if you've been published once or twice in your lifetime. Your entire career is accomplished if you've been published once or twice." Dr. Prasad has been published more than 250 times. So it is my pleasure, my privilege to bring to our discussion now Dr. Kedar Prasad. So Dr. Prasad, thank you very much again for joining us in our discussion.
Thank you, Jonathan. I'm very glad to be here and discuss, as you know, I have published some books on this issue. And what I will say, for example, macronutrient mixture or micro daily EMF, its parent was micro daily, for which we have enormous amount of testing done on human as well as in animal model, and to reducing the damage produced by free radicals we call oxidative stress. And when that happens, you also have a chronic inflammation that releases a lot of toxic chemicals. So it is fair to say that micronutrient EMF will do at least that much or better than what we have done with the parent micro daily alone. And as far as the collagen peptide is concerned, there is a lot of clinical data in human available. So there is nothing that I can say that would be.
Hang on 1 second. We're going to see if we can't get our lines quieted down a little bit.
Okay. This is a history of diabetes. I thought you may be interesting to know how it existed. As it said, diabetes existed throughout human history. No question about it. 1550 BC, Egyptian medical book described this disease as a frequent urination. And as you know, it is one of the symptoms of diabetes. But even in those days, they knew it, but they didn't know about the word diabetes. Indian Ayurvedic medicine referred diabetes as a honey urine. And they were used to diagnose it because the insects and flies, and they will accumulate near the urine because it has sugar. And so they said it is honey urine. In 2nd century, another guy, Greek physician, coined the word for the first time. In 2nd century, coined the word diabetes. And in 17th century, an English physician added the word mellitus, means sweet urine. So as you can see that they're now the technical word, but it is the same. Now, what kind of diabetes are? As you know, type 1 diabetes, this is inherited from the parent, and because beta cell of the pancreas cannot produce insulin. So you have to have insulin for the treatment. Diabetes 2, which is the most common, occurs at any stage. After adolescence, pancreas beta cells produces sufficient insulin, but body develops resistance to insulin, causing increased level of sugar in the blood referred to as hyperglycemia. So this is type 2 diabetes. Gestational diabetes developed during pregnancy in female, but it disappears after the birth of a child. So this is not a serious issue. But type 2 diabetes that we will discuss, most of them would be regarding type 2 diabetes. Next slide.
So these are all the primary types of diabetes.
Right.
I read something once that they tried to start categorizing other types of diabetes, but they're mostly in the pre-diabetic category.
Yeah, the pre-diabetic is a different from the pre-diabetic, or sometimes you have also obesity. Those are risk factor, but pre-diabetic cases are a little bit different. They don't have to develop diabetes, but it is a pre-diabetic, and if they are intervened earlier, they cannot go to diabetes. But if you don't do anything, pre-diabetic patient with pre-diabetes will develop eventually diabetes. Here are the very common risk factor. More common in older individual, but it occurs also if you are younger and obese. It is a risk factor. Obesity, like he's saying, I love that picture of obesity. The lack of physical activity is a risk factor. Distribution of fat in the abdomen, as you can see that many people have it. Ethnicity, do you know, in this case, the white population is much higher, 3 or 4 times higher than, say, Asian. Asian has the lowest level. Next comes black population.
Is that right? Now, I would not have thought that, Dr. Prasad. I had a hamburger today just before we started this presentation. It's grass-fed beef now, and my wife made it, so I hope that is okay.
It is very good.
Okay.
High sugar consumption. I love sweet, but if you take once in a while, is okay. Age, as I said, is a risk factor. And of course, pre-diabetic condition, if not treated, will develop full-fledged diabetes, but it can be prevented from getting the diabetes. Next.
This lack of exercise is a major component.
Yeah, because that also contributes to obesity. Because if you don't eat it, you don't burn calories. If you don't burn calories, fat deposits, wrong place, and then you have a risk factor.
I read one study that said that you have a 70% higher mortality with lack of exercise. So
yeah, exercise is not only important, but it also releases endorphin, which is very useful for your happiness and well-being and so on.
Right.
Now, these are the major symptoms of type 2 diabetes. Increased thirst, frequent urination. As you know, it was noticed as early in 1550 BC.
Yeah.
Increased hunger, unintended weight loss. Sometimes it happens. Fatigue, blurred vision, numbness and tingling in hand. This is a classical symptoms of diabetes. And if you have some soreness and got injured, it is difficult to heal.
Yeah, my father-in-law,
because of the vascular changes that occurs in diabetes cases.
Yeah, my father-in-law was just being amputated one thing after another because of poor circulation. Just horrible.
Yes. Now here the incidence. Incidence, when we talk about incidence, it is a per year. When we talk prevalence, means how many people at this time exist with diabetes. So incidence is number of people per year, but prevalence is number of the population existed at that particular year. So you can see that 1.4 million newly diagnosed among 18 years and older. This is incidence. Incidence in men is about 6.6 per thousand, and in women, it is about 5. So women had a little bit less incidence per year than men. Now, prevalence, how many total number of people exist right now? It is 28.5 million diagnosed among the 18 years and older is diagnosed, are having, not fully diagnosed is the people. White people, there are 22.2 million. Black is 5.4. You can see that is very, very high among white, which I was surprised. Asian has the lowest number, 2.7 million, and Hispanic is also low level.
That is
And
surprising
type
to
1
me, Dr.
diabetes
Prasad.
is 1.4 million.
That is that's totally surprising to me that the number of white individuals in this country have higher prevalence of diabetes.
That's why the
I would expected
CDC
that.
statistic, me surprised too. This is all taken from the CDC fact check, of the diabetes. So it is government official data. And I was surprised too. I thought that the, Hispanic and Black and Asian, we have a higher incidence than white, but that's what it is. They
Right.
always call a white non-Hispanic, but it's
Right.
a white population.
Mm-hmm. That's amazing. That is just
And this is
absolutely amazing
most
to me.
data is 2019, so it is very recent data. And not recent, but a few years older.
Right. And you say here this prevalence of 28.5 million. I think it's like you said, it's up higher now. I think it's around 30 million or so now.
Yeah, 37.2 million is if you put up pre-diabetic cases,
Right.
and also there are one category was undiagnosed people, then it becomes 37
Yes.
million.
Yes.
But
yes.
actually diagnosed one,
Yes.
and
Gotcha.
the cost, and you can see that not only the cost of the family, but enormous cost of the country, nation is amazing. It is in 2017, the cost was $327 billion. If you include the cost of treating undiagnosed and pre-diabetic cases and gestational diabetes, total cost was $403 billion.
That's
You can see
mind-numbing.
it is major problem. It is a per year. It is a per year cost. This was just 2017 alone, and probably today, after almost 5 years, might be much more. But the statistic was available for only 2017.
This is just mind-boggling, Dr. Prasad, because if we even start to have a conversation about cancer and heart disease, you can see it's a huge percentage of the gross domestic product. The whole
Exactly, yeah, and so it is now. Now the question would be that how, when you take a glucose, how the glucose get transported to your blood and get used. Whenever you eat any kind of meal, your blood sugar increases immediately. And then blood sugar invites pancreatic cells, beta cells, to produce insulin to take care of the high glucose that we had after the dinner or lunch. And then there in a blood, there is a protein called glucose transporter protein 4. There are many types, but there's 4 or 5 types, but gluten 4 is the main which transport. This is a protein. So this transport glucose to the cell surface, muscle cell, any cell surface, and fuse it, and then wait. Then the high glucose has already invited that insulin come into the bloodstream. Then insulin goes and binds with the insulin receptor at the same time, side by side. And when glucose transporter protein, which is carrying a glucose molecule with it, sees, oh, there is now exposed to insulin, then they get released. So fusion for the membrane. So glucose transporter protein with glucose gets released inside the cell, where the glucose gets released and used for producing energy in the cell. So glucose transporter protein is extremely important. They have to remain functional. And so is the insulin receptor. An insulin receptor is also protein. And so you can see how on the cell, they interact with each other, because if one is defective, the other can't do anything.
Right.
Both system has to be intact, functional, in order to have a glucose don't accumulate in your body and get transported and used for energy.
Wow. That's pretty remarkable. There was one scientist, Dr. Prasad, that mentioned that these beta receptors, the beta receptors on the pancreas, that's what senses the presence of glucose. So if oxidative stress has attacked the beta receptors, or if the immune system has attacked the beta receptors, that's what stops it from being able to detect the presence of sugar, of glucose.
No, I think that thing, beta receptor, is attacked in type 1, because if the cell is damaged, beta cell is damaged, then it
Okay.
can produce insulin.
Mhm.
So one of the theory of type 1 is that it is autoimmune inflammation that produces a damage to the beta cell, and
Right.
therefore it can produce it. But for type 2 diabetes, it is increased oxidative stress. And you will see that, I think it is next slide.
Okay, I got you.
Oh, this is the complication.
Complications, yes.
Okay, let us see complication. The complication of if you don't get treated well, or despite some treatment, despite of the current treatment, may develop retinopathy, but rather slowly than if you don't treat at all. So retinopathy exists at this moment in a diabetes. 4.3 million people have retinopathy, which is eye damage. Nephropathy is kidney damage, and 37 million people have kidney disease, out of which 786,000 has an end-stage kidney disease, and then 71% of them end up in getting dialysis, and 29% get kidney transplant. Neuropathy, which is a nerve damage, 50% of the diabetic patients develop neuropathy. Heart attack, 90% of the diabetic people have some kind of heart attack and a stroke. Another thing is food damage. They get food damage because of the poor vascular system, like Jonathan, you mentioned. If they are not treated appropriately, causes 185, I think it was wrong, 185 amputation per year. And in this case, African blacks suffer 4 times more than the other populations.
Wow. I wonder why that's the case.
Because they may ignore the treatment.
That's true.
They may ignore the treatment. They don't have a right kind of treatment.
Yep, that is true.
The
My mother
both.
was walking. My mother was walking around for a long time. She had a sewing needle in her heel.
Yeah.
This long. Wasn't even aware of it.
And also, as I said, once you develop sore, it is difficult to heal.
Mm-hmm.
And therefore, and again, all this the complication, you see that, or
Yeah.
diabetes per se, in all cases, increased oxidative stress, which is produced by excessive production of free radicals, and chronic inflammations are involved.
Mm-hmm.
So if you can decrease them, not only in a diabetes, we have 2 issues. First, how to prevent it,
Right.
and how to improve treatment.
Right.
For prevention, you have to know what are the biochemically in your body happening that is causing the initiation and progression of diabetes.
Mm-hmm.
We saw some risk factor, they are there, but also all those risk factors that we mentioned, they produce increased oxidative stress and chronic inflammation.
That's
Or
incredible.
all risk for obesity, any other risk factor that we mentioned, lack of exercise and excess sugar will produce a lot of free radicals. And so all the risk factors that I presented to you, they produce increased oxidative stress and chronic inflammation. So if you can reduce them,
Yep.
as soon as you say that you are taking a risk factor, once you know what are the risk factors, you are aware of that. So try to reduce them, but nobody, human behavior are very difficult to change.
Yeah.
But you try to do as much as you can, those factor reduction, but take micronutrients, which are known to reduce oxidative stress and inflammation. And as I said, the parent of the microdaily EMF have done all those things, tested in human. And so I feel comfortable in saying that in a human, for good health, for many other health issue, that wherever there is increased oxidative stress and chronic inflammation, which you look, the literature linked almost all chronic diseases, including diabetes, then you can prevent it.
That's right.
And now, and you can say how you can improve the treatment. So next slide, see what is there.
Before we go there, all of this makes so much sense. The gentleman that talked about at the very beginning there, Oscar, who talked about his A1C dropping.
Yes,
Everything you're saying is all check, 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 explaining why he had the results he got.
that's exactly right. Those things reduces oxidative stress, and that blood sugar goes down, A1C goes down, because once the blood sugar is down, then they have a less oxidative stress, and therefore everything is going down. A1C will go down as well.
I see. So this is the oxidative stress you're talking about right here under the major
Yes.
cause of type 2. I got you.
Yeah, yeah. Next one, see what we have.
This is the one you just did, major complications. This is the causes where you get into oxidative stress.
Yeah, yeah. And as I said, these two events now, the last slide is very important.
Okay.
These two events, no, I will read the
I'll go
last
back.
slide. Yeah, can you go back? Glucose transporter protein and insulin receptors are damaged. And if they are damaged, they cannot transport glucose to the cell. And if there is a damage to the insulin receptor, they would not allow the release. Suppose if the glutamate receptor
Okay.
protein is okay, but it goes to the C, and if the receptor is damaged, that they cannot go inside the cell.
Okay.
So it is very, very important that both are healthy and functional in order to do the job. One item is functional, other is not, it will not do the job.
You can't just target one particular thing with a diabetic. You've got to, if you're not hitting every aspect of oxidative stress and free radical
Yes.
damage, you've got nothing.
Yeah,
It will fail.
yeah. I think, if you don't do, and none of this is the thing is that how the glucose is produced in the body, from the liver and so on. So all the medication, but that is different disease. So for prevention, this is very important. So you can see that daily EMF could protect the glucose transporter protein 4 and insulin receptor by reducing oxidative stress and chronic inflammation, while probiotics with prebiotic that we have would shift the balance in favor of beneficial bacteria in the gut. Because in a diabetes and in all, even the older people who have no disease, the probiotic balance shifted in favor of harmful bacteria. And harmful bacteria which generate a lot of inflammatory cytokines, which are very damaging to the cell because it will be absorbed from your intestine and will cause damage. So to shift the balance, how do you shift the balance? That's why probiotics with prebiotic that we have, that will shift the balance in favor of a beneficial bacteria, and therefore it will be helpful for your overall health, including diabetes.
That's a powerful argument for making sure that we keep the good probiotic.
Yes, I was surprised that even the people who are older and apparently have that the shift occurs in favor gradual. This is not overnight. This is a gradual phenomenon. And then when they develop disease, then it gets worse.
Incredible.
Yeah. Now the question is how you improve the treatment. Current drug treatment have slowed down the progression of diabetes too, no question about it.
Right.
However, diabetic-related complications do occur rather slowly, despite the fact that patients of diabetes are taking more than one medication, 4 to 5 drugs.
That's right.
But it does its job slowly.
That's right.
These do lower the fat. These drugs do lower the fasting glucose, reduce A1C, but they do not reduce oxidative stress and chronic inflammation. Therefore, the disease continues to progress rather slowly.
Dr. Prasad, that statement right there is just mind-numbing for anybody who understands anything about diabetes. All conventional things are doing right now, and I don't mean to be just so melodramatic, is dealing with the symptoms. They're masking the symptoms.
Yes.
So unless you get to the root of the problem, which is this oxidative stress and chronic inflammation,
yes,
it'll still be there.
Yes.
That's why it's never cured.
Yeah. And so the question is how we can improve them. That's a very important question. How we can improve.
That's amazing, Dr. Prasad. So this, I guess, is the reason why we're here. Go ahead, please.
Yeah, improvement of drug treatment in diabetes with micro daily and EMF, collagen peptides, and probiotic. Probiotics, we already said it. Micro daily EMF could improve the effectiveness of the medication that people are taking by reducing the progression of diabetes complication by decreasing oxidative stress and chronic inflammation. So it will improve the effectiveness of drug and reduce the further progression of the disease and complication of diabetes.
Which is what everybody would be wanting to have happen. They would want
to happen.
The drugs
Exactly.
work better.
Exactly. Collagen peptides, and I will show you the data, improves the production of the enzymes.
Mm.
The collagen peptide improve the production of insulin by reducing the activity of the enzyme DPP4. And this enzyme destroys or reduces the production of insulin. So collagen peptide says, and it is very interesting, one of the three, four drugs, prescription drugs, which are also inhibitor of DPP4, but they are very toxic.
Oh my.
But in this case, this is non-toxic, does exactly same thing. And so it is very important to remember that. So probiotic with prebiotic would shift the balance in favor of useful bacteria. That's
is
why
amazing.
we recommend all three.
That's amazing, Dr. Prasad. So we're saying here that a natural product that we have right now is actually currently being marketed as a drug. The function of this is being marketed as a drug right now, but this is a natural.
Yes, this is a natural product.
Natural product that does the same thing with no side effects.
There are no side effects. And you will see that there has been a double-blind placebo clinical trial. You have,
tell us about this.
This is the double-blind placebo-controlled study with collagen peptides on type 2 diabetes for 12 weeks showed the following results. You can imagine. The patient had a fasting glucose because they were on many drugs. They were on 4 or 5 drugs already. So fasting glucose in drug groups, they were taking drug, has 125 milligrams because they decreases. But if you had a collagen peptide plus drug, then it further reduced to 105.
Wow.
Within 12 weeks.
Wow.
A1C in a drug group, you expect that it will be low, 6. Collagen peptide plus drug together, drop it further.
Wow.
And insulin resistance also happens. They were number 6, there's some measurement unit, they decreased to 5.
Oh.
So you see the collagen, I never thought that. I never thought that when I made collagen peptide, I never thought this beneficial effect until this paper just came out a few weeks ago.
By the way.
By the way. So whatever we are suggesting people, we always say, like Johnson say, you consult your doctor. But these are very non-tricky approaches, and it does not interfere with what drug you are taking.
It just makes it work better.
Yeah, you can see that it works much better, and therefore the prospect of developing a gradual complication of diabetes is markedly reduced, even if you have a diabetes already. But prevention, we discussed it, prevention is also very important.
Wow, I hope everybody understands this. This is the results of a double-blind placebo control study.
This is what clinicians love it. No clinician will then, if you say this, that it will have no clinician will argue it because it's double-blind placebo trial.
Double-blind placebo study. That's incredible.
So how does collagen peptide help diabetes type? People can ask always. That this is enzyme DPP, and there is a long name.
Yeah.
It reduces the production of insulin. So if you have reduced insulin, then you have a problem. Glucose will accumulate. Therefore, inhibitor of this enzyme would improve the production of insulin and decrease the level of glucose in the blood. Therefore, they are prescribed in the treatment of diabetes too. Such drugs also produce, but such drug produce serious, not ordinary, serious side effects.
Right.
Collagen peptide inhibits the activity, but it is not toxic.
Wow. That's a strong, strong argument.
It is very strong argument. This is, again, it's a clinical trial. Probably the last slide.
And I think folks are just really starting to get this, Dr. Prasad. But
Yeah.
they need to hear you summarize everything
Yes.
right here. This is powerful.
Yeah. It is a summary. That's what it said. Micro daily EMF in combination with probiotics and prebiotics could be useful in the prevention of diabetes. Micro daily EMF in combination with collagen peptides and probiotics with prebiotics could improve the effectiveness of drug in reducing the progression of diabetes and diabetic-related complication in diabetes type 2.
That's incredible. And I encourage everybody, just take a screenshot of that slide right there. And there's your argument for taking the Dr. Prasad choice. We didn't even get them to comment on the eye boost. But as you can see, vision problems is all part of the complications of diabetes. So maybe next time, Dr. Prasad, we'll drill down some even on the eye boost, the benefits of that in relation to this as well.
Yeah. And some people have, like, in one cases, remember one patient in your talk or somebody your talk was saying that his eyes had increased proliferation of blood vessels. We call it angiogenesis, means proliferation of blood vessels, and that they can rupture and cause damage and even blindness. But at least there has been a lot of paper, I'm reviewing it, that vitamin E succinate, which we have in our micro daily and micro daily as well, they have been shown alone by itself that it prevents the angiogenesis in a cancer, because cancer also metastasizes by angiogenesis, and therefore it prevents, at least in the animal model, the metastasis of cancer by preventing angiogenesis.
Wow.
And so we have some very useful ingredient there for all kind of health improvement in health issue. And now I will be glad to answer any question that people might have.
That's phenomenal. Well, before we go there, I know we're going to have a bunch of questions. There's one more testimonial that we'd like to share with you and get your comments on it.
Sure.
So this is Greg's brother-in-law, and he had some documentation, some supporting documentation he shared with us also. So Nick, can we go ahead and cue that testimonial?
That's good.
Yeah, we saw it there for a minute. Nick, go ahead.
All right. Now this was in July. All right. My brother-in-law, he's got diabetes, high blood pressure, and stage 4 kidney disease. Okay. And they both been on Micro Daily about, I'm gonna say about a month and a half total. Okay. They started in, let's say, August 6th. So September, yeah, about a month and a half, almost 2 months. Now my brother-in-law, man, I don't even know what to say about this. His blood sugar is leveled out. He's still at 114, 125. That was, before when he woke up, he tested it, and it was at 300, 350. After about 4 or 5 days of being on Micro Daily EMF, it went down between 114 and 125. He was happy just about that. All right, now his high blood pressure has leveled out. Okay, to where, he's scared to take his medicine for his high blood pressure. I said, no, go ahead and take it, dude. I said, you take your medicine, let the doctors tell you not to take it.
Yeah.
All right. Now, yesterday, he's got stage 4 kidney disease, and he's going Wednesday for his checkup on it. He went and got his blood test, and we've been waiting on the score back from the it's called the EGRF number, which
Easy.
tells you when you need to go on dialysis.
Mhm.
His number last month was 15, which is 1 away from going on dialysis. Last night, when he got back yesterday, we checked his my chart. You ready for this, man? He's been on it a month and a half. His number went from 15 to 26.
Did the doctor go back and check it again just to make sure?
We ain't went to the doctor yet. That was they sent him for a blood test a week before his appointment. So I myself is going with him on October the 5th to his appointment, and I want to see what the doctor has to say about what he's been doing.
Yeah.
Take a recorder.
Oh yeah, absolutely. So, but yeah, I was waiting. I said, don't let it stay the same or grow a point or two, because I will not shut up about Micro Daily. It went up 11 points, so I'm ecstatic. He's ecstatic. We was like, oh my goodness. So yeah, because I checked I got my little printout right here, man. I was going over it with Willie, and I said, look, mine's at 78 the last time they checked it. His went up 11 points. So I told Rob, man, I've been telling everybody. I mean, I got my flag planning, dude. Everybody and their mama's gonna know about Micro Daily from Greg. I can tell you that, brother.
Well, that's a bittersweet piece of news there, Greg, because what you just said indicates that my other mother, if she had just continued, instead of heading toward dialysis,
That's amazing.
could have been a different outcome.
The reason I firmly believe they was wanting to cut on his arm, on his left arm, to put that little, I guess, device in there for his dialysis. And they was like, well, they already told him, well, you're going to need dialysis anyway. Let's go ahead and get you started on that and get your report ready. And then, because it's going to take 4 to 6 weeks for it to heal. I was like, he's 1 point away. What happens if he needs dialysis now? And, he said, I'm going to wait until my doctor's appointment and see what the Micro Daily does.
Yeah.
Okay.
I said, might as well. So he waited, and it went up 11 points. So I'm ecstatic. I can't.
Thank you.
I didn't go to sleep last night at 3 o'clock.
That's incredible.
Thank you.
That's incredible. And Dr. Prasad, we've had conversation with him since then. He brought back documentation where his glucose levels had improved, his sugar levels, A1C improved, the numbers, everything, it was just off the Richter scale better after this gentleman started on your formula. So we can't thank you enough for introducing us to something that has the potential for having a massive impact on that dreaded disease, diabetes. So thank you for that.
You see why you are seeing so quick effect is that the glucose transporter and protein, all the time they get damaged, then they get removed from your system, the new one is formed. But if you have not done anything to them, then they will continue to be damaged more and can transport glucose. Same thing is true with the insulin receptor, because oxidative stress damages and inflammation, chronic inflammation, damages both transporter protein as well as the receptor for insulin. So once they get a new one, and now you have a low oxidative stress, have reduced them, so the new glucose transporter protein is formed. Now they are protected. Insulin receptor, the new one, is protected from the damage, and therefore now they can transport glucose and insulin, and then you can use the glucose very well for your energy.
Absolutely, just wonderful. Let's go ahead and take some questions.
Yes.
And remember, folks, when we share with you testimonials and things like this, testimonials are purely anecdotal. What happens to one person may or may not happen to you. The FDA has not evaluated these comments. And Dr. Prasad, we are not recommending that Micro Daily, Engage Global products, Collagen Daily, Probiotic Boost are a treatment or cure for any disease. But they just help your body do what it's designed to do. It's the food that's missing from our food.
Yes.
So from the questions that we have, for those who will be asking a question, keep your question brief, please. And we'd like to try to contain our questions to the subject matter at hand, if at all possible. We'd like to focus in on, we're talking about diabetes right now. So if you have questions related to that, please relate that. And we'd love it if you could come on camera, because we would like for you to be on record with this. So let's go with the first question that came up with, first hand that was up is Mary Thompson. So let's go with Mary Thompson.
I have is the Micro Daily EMF that said in combination with probiotic and prebiotic could be useful in the prevention of diabetes type 2. But the young man, Greg, that said, it seemed like his brother-in-law, he just took the micro EMF and got good results with our diabetes that he already has. So is it for prevention of diabetes, or it could also help those who already have diabetes? Just the Micro Daily itself, not the.
Good question.
I think the Micro Daily is useful for both cases, in prevention as well as improving the efficacy of the drug treatment. And because Micro Daily EMF will reduce oxidative stress and inflammation. And probiotic is a new phenomenon people are not aware of, but he's happy with that. But as I said, further, it is not just the diabetes situation prevention, but also overall your health. It is very important. If he's young, then he doesn't have to take it. But if he's older, 50 years or older, then in that scenario, I think I will recommend probiotics. But again, for not only for diabetes, further improvement in prevention, but also in overall health, it is important. But if you are happy with Micro Daily, it is okay.
Thank you so much.
Sure.
You're very welcome. And thank you for asking your question, Mary, Ms. Thompson. Just to mention before we go to the next question, the patent that was issued for MMF actually include the word treatments for diabetes mellitus.
Yeah, and actually, as you know, that we in a Walter Reed Army Hospital, we had a collaboration with my previous company. We have collaboration going on diabetes in veterans, because the incidence of diabetes in veterans is as much as in civilian. And so, but the study went, but the old company that I was working with, or actually I formed, declared bankruptcy, so it could not go any further. We have a lot of samples sent to us from there, but company went down. So, but the important thing is that for the treatment of that, in combination with the standard therapy, the Institutional Review Board, which is called IRB of the Army, approved the protocol for using our product, which was at that time just Micro Daily alone, in combination with a standard therapy in patients with diabetes. So they, as far as the safety and other issues concerned, they approved the protocol, and we have started doing the experiment, but we couldn't complete it.
Wow, that's pretty remarkable. Okay, well, very good. So Robinson family has a question now. Oh, that's Tim. How are you, my friend?
Hey, how you doing, John? All right. Yeah, my question is, got a family member, sister-in-law. She has dealing with the kidney dialysis, and that video you showed, his brother Greg was in stage 4 kidney disease, but things went better for him. So did it get to the point that he doesn't have to take the dialysis at all? Is that what the EMF does?
Well, I think, in case of dialysis, there is a lot of oxidative stress occurring because of not only the diabetes, but also the procedure that it goes through. And therefore, I would say that taking a micronutrient, or say EMF, would be very useful for improving her health. But I don't know it will reduce the requirement of dialysis, because in that case, your kidney is not functioning at all. That's the reason you do dialysis. And so question would be to see what happens. I mean, it could not hurt it, but it will improve overall feeling, because these people, I was told, that feel terrible after kidney dialysis. And actually, a friend of mine, Dr. Cole, who was one of the persons that very close friend of mine, he had a kidney transplant, and doctor said 17 years, but he had been taking a micronutrient that I developed, not necessarily, it is very similar to what we have today, but he has been taking, he and I both are taking forever. And so now it is 29 or 30 years, and still he's okay, but kidney function is decreasing. So doctor said, you have a choice of dialysis or kidney transplant, but he's very close to 70. So I said, no, I'm ready to go. I don't want dialysis because it is you feel very terrible because of oxidative stress and some other procedure that it goes through. So I would say that it is worth trying it and see, it will improve your health and you will feel better. At this time, that's what I can say. And then after 90 days, say, for example, let us, Jonathan, know how she's doing it.
Okay, so the Micro Daily or the EMF or both at the same time?
Micro Daily EMF. And again, for a better absorption or quicker, I don't know how old she is, but if she's an older person, then I would say that, it will be a good idea to have mixed with the yogurt to content, 3 in the morning, 3 in the evening. It is very easy to open the capsule, and for her, require a quick absorption, and so that she feels better. So that's what I would recommend.
Thank you for your time. Appreciate it.
Sure.
Thank you very much for your question there, Tim. Appreciate that.
You're welcome,
And,
Jonathan.
he made reference to Greg's question or Greg's testimonial earlier about his brother-in-law. And so far, his brother-in-law has not needed to go on dialysis. They didn't. install
But exactly. But she's already on dialysis.
Yeah, right.
That's,
It's a
so
big
the
difference.
question is, what will happen? Is this kidney function improves? Doctor will decide at that point.
That's
but
right.
we don't know. We know that at least she will feel better. That much for sure.
Yep, especially because of the amount of stress of taking the organ out of the body and
Oxidative
putting it
stress.
back in. That'll
Yeah.
reduce for sure.
Yeah.
Okay. How about Rice? Rice. No
Jonathan?
cameras on. Oh, hang on.
Jonathan,
Yes,
I was
please,
gonna-
go ahead,
I'm going to
Jeff.
just jump in here right now and say, you know what? We have had individuals in the last several months, after 8 years of being on dialysis, are starting to have the urges and are actually going to the bathroom again. So it's 8 years of dialysis and
8 years.
things are happening. So that's just how I'm going to leave it.
That's amazing.
That's
amazing.
good, Jeff.
So please give us the
this-
update.
it's amazing. This is amazing what it can do. And as I said earlier, that many things we know about vitamin decreases oxidative stress and inflammation, but it has many other functions in your body, or also improve immune function, but in other functions that we don't know about it. And here are the examples. I could not have predicted that based on what is available sciences, but nature has all kind of secret formula.
Yeah. It was
That's incredible.
It's been amazing. So thanks for letting us just jump in.
No, thanks very much.
Thank
Yeah.
you. Okay, R. Rice would like to ask a question.
Yes, I can't really come on camera right now.
Okay, that's all right.
Question. I have a family member that's on dialysis and not doing very well at all. So at this point, we're gonna bring him home and he will receive dialysis at home. You know what our goal is already. You already know, Mr. Jonathan, is to have him on these products.
Yeah.
And I got some of the family members on here. What products should be administered to him, and how should he take them?
Yeah, I think, as I said, that Micro Daily would be very good. And also in that case, collagen peptides and probiotics, those three I would recommend, and take after 90 days. Let Jonathan knows how your family member feels.
Okay, now, and those products I did order and they will be here on Monday. Thank you.
Okay.
I did
Sure.
order those. But how should we administer?
Oh yeah, there are two ways of doing it. You can take capsule, but sometimes under that condition, people may not take capsule form, and so the best is to do in a yogurt. Open the capsule, 3 capsule in the morning and 3 in the evening, and open the content, mix it up, and take it, and it will be absorbed very quickly, and you will feel better.
Okay, 3 in the morning and 3 in the evening.
Yes, and probiotics once a day, and collagen peptide once a day.
Okay, thank you so very much.
Sure.
I appreciate you.
Thank you very much, for coming on and asking your question.
Thank you.
LG Style 06 has a question. Your name, please. Let's get you to unmute.
Okay.
Yeah, now I can hear it.
Okay. My name is Kimberly, and I was diagnosed with type 2 diabetic. And I also was threatened about my kidney, that I need to keep a close eye on my kidney too. But I wasn't told the numbers for my kidney or anything like that. So I was just wondering, I plan on ordering the Micro Daily. I haven't done it yet. And I was just wondering, do I take that? And someone probably already answered that question, but I was wondering, do you take that at the same time, the medication that the doctor giving you? Because I really don't want to take the medicine the doctor giving me, period.
Of course, yeah, you must take it, doctor, medication that, and as I showed one study that Micro Daily, the collagen peptide improves further, and therefore, yeah, but the difference may be an hour apart. And that will be plenty if you take in first, either you take first Micro Daily EMF, or you take medicine first, an hour later you take the other one. And the collagen peptide you can take anytime. The probiotics you can take anytime. So I think that should be, and it will be very helpful for you.
Okay. Thank you so much. That's the only question I have.
Sure.
Thank you, Kimberly. Great question. Daphne Miller has a question.
Yes, thanks for taking my question. I have a question and a comment. First of all, the comment is I really appreciate your explanation of why the Micro Daily helped the diabetes symptoms right away. Because not only when you explained that, it really helped me to see why I did that with my, I had cancer in 2014, and I have a lot of residual pain from it. So when I started taking the Micro Daily, it really, within a matter of 3 days, I think I told Jonathan and everybody else, I did not believe that it was the Micro Daily. But I couldn't figure out what it was because the pain was really serious. I have a high tolerance of pain, but with the Micro Daily, my pain level has really dropped. I have a neuropathy from cancer. But my question is, and my mother has diabetes. When she take the Micro Daily, it improved her A1C, but she'll stop sometime. You know
Of course.
but she don't start it back. So hopefully that'll get back on track. But my question is with the diabetes, I mean, not diabetes, high blood pressure. I never had high blood pressure before, but lately, my blood pressure been kind of acting crazy. I think it might be the fact that I've been concerned about my mother. I'm losing weight, but I'm losing weight because I want to. And my health I'm feeling good. My mental clarity has really improved. But with the micro daily and the blood pressure. Do I need to increase the micro daily?
No, no. Sometimes, no, I don't think so. You take a 3 capsule in the morning, 3 in the evening. And, under doctor care, you may have under doctor care for blood, other issues.
No, I don't have, I'm not under doctor care for blood pressure. It just started. I go to him in November sometime. And I've been taking my blood pressure myself, and I can feel it. But
Yeah.
I don't know if, I don't know why, because I'm feeling good. I really am.
Yeah.
But
I mean, some people reported like you that their blood pressure was high and that had diabetic situations. And then they became decreased after taking micro daily. So how long you have been taking?
Oh, I've been taking micro daily since April of 2021, when I was
Okay.
introduced to it.
Okay, so you have been taking for a while. And, for again, if you have some, what do you call it, but you are not taking collagen peptides, are you?
Yes, I take collagen peptides, but I have not been taking the probiotic because I take a probiotic. So that's a good question. Is what's the difference in the probiotic I might be taking, which I get from a health food store?
Yeah, no, because see, the main difference is that we have most of the probiotics like we have in the intestine, which is good, Bifido strain and Bacillus strain, those 2 strains of bacteria. But when you take orally, 70 to 80% are destroyed in the intestine pH of the stomach, very low pH. So they get destroyed. Then they go to bile acid, they further destroyed. So by the time you go to the lower colony, there are not too many left around. And so what we have added it, and why it is different, we have added it to a strain of probiotics, which are heat resistance as well as the pH or acid resistance. And none of the product commercial market have that. And so for example, I have a Bacillus coagulant, which is acid resistance and heat resistance. And this is the only probiotics that has been approved by the FDA to be given in an infant formula, because infant intestine is sterile, and the risk of getting bad bacteria, harmful bacteria is high. So in order to prevent that, they recommend Bacillus coagulant, which we have added in our formulation. There is another probiotics, which is also heat resistance. They come from yeast. Is the Saccharomyces boulardii, and actually, doctor will recommend both. People who have an intestinal bowel syndrome, the inflammatory bowel syndrome, will recommend either boulardii, Saccharomyces boulardii, or Bacillus coagulant individually. So because they have done a lot of human clinical trial and they have been effective, but they did by itself. So what we have done in our product, we have also good bacteria, Bacillus, and as well as Bifido. And also we added 2 additional strains which are acid resistance, is the Bacillus coagulant and Saccharomyces. So these are different. And actually my wife was taking probiotics recommended by doctor, but didn't do any good. But as soon as she started taking our probiotics, she claims to see 80% better.
Okay.
That's powerful. Thank you, Daphne.
Sure.
Bernard has a comment.
There was something took place today that I need to relate to you on this.
Sure.
And Dr. Prasad, you were the one that brought this out. I had a person call me up day before yesterday and says, I don't need to take this because my blood pressure is off the chain. I was like, wow. I said, everybody else's blood pressure is dropping while yours off the chain. I can't figure out why. Then I had another person call me up that told that actually just came in 5 days ago on using the product. His basically his leg is shrinking and he's got a crazy testimony. But he said something that relates to what you just said. Dr. Prasad, you told us that if you do not drink enough water,
Mhm.
that you take these products, your blood pressure will rise because you don't have enough water that's circulating to make this product work great. And I thought that was interesting because he picked it up in one of your presentations. And also, it needs to be taken with food in order for it to have its full effect.
Yeah.
And it's interesting that person asked that question because I've only had one person who blood pressure rose, and that person had to admit that they did not drink enough water and they didn't take it with food.
Oh,
So
wow.
maybe people need to hear how this product need to be with food and water to
Yeah.
get the results that you're talking about.
Yeah, I'm
There it
glad,
is.
Bernard, you brought up that way. Yeah, this is very, very important. This
There
is
it
very,
is.
very important.
That's powerful. Thank you, Bernard, for bringing that in.
Yeah.
It
That's
just
actually-
happened to have happened yesterday and today. And that person today called me up and told me, he said, Dr. Prasad told me. And all of a sudden I realized that here is that exact scenario.
Yep.
Yeah.
That's right. Very good. Very good. Thank you. Okay, so that's a strong one. These are the actual products here for anyone that's asking questions about them. You can get back with the person who invited you here, and they will guide you to the bundles. There's 3 different bundles. There's the premium bundle, there's the optimal bundle, and this one here is the Dr. Prasad's choice bundle. And this is the one that we highly, highly recommend. But speak to the person who invited you, and they'll help you to make a decision about which one is the right one for you. Go on subscription though, because you need to be on it for 90 days. No matter what you choose to do, you need to be on it for 90 days. And you know what? We have Greg here right now.
One more question.
Go ahead, please. Oh, one more question. I got Greg here, and Greg shared the story earlier today. And he's either asking a question or giving us a little bit of additional information.
What's up, Jonathan? Hey, Dr. Prasad.
Hi.
Just wanted to give an update real quick
Uh,
because Randy went back to the doctor on the 12th of this month. July 12th, his A1C was 11.4. October the 12th, his A1C is 8.2. So he's not out of the wood yet. Dropped. He's not out of the woods yet, but it's going in the right direction. His kidneys is going in the right direction. They're going up, and his A1C is coming down. So
Good.
we'll find out more in January because they can only test it every 3 months.
Good.
So
I'm
Very
glad.
good. Very good. Okay. Thank you, Greg.
where we stand there. So since this is a diabetes webinar, I just wanted to give that update. That he's at 8.2 now. So
Perfect.
Thank you.
Thank you. Thank you very much. Dr. Prasad, Catherine Robinson has been waving her hand there.
Okay, one more.
Minute. We take her? Okay, let's bring Catherine Robinson on so we can hear her question. Don't forget to unmute, Catherine.
Y'all answered most of it. Only got one small part. Y'all covered everything. On
That's
the
okay.
Micro Daily EMF for diabetics, I believe the other day it mentioned 3 times a day. Would that be the recommended amount of just the Micro Daily? You told me about the collagen and the probiotics. Is that the case, or can be?
We suggested, Dr. Prasad recommends sticking with the basic amount, but what Jeff and I have recommended is increasing it in the case of those with diabetes, because we've seen it in the field. That having a higher amount initially makes a difference. They can taper off later, but that's not what Dr. Prasad will tell you. So that's something that Jeff and I have been encouraging.
And also it is non-toxic. So if it helps you, then up to you to decide. But generally recommendation for is twice.
Excellent.
Okay.
That answers it.
All right,
Appreciate
thank
it.
you very much, Catherine. Dr. Prasad, this is the last hand right here.
Okay.
So looks like it's just a real quick one here, okay?
Sure.
Go ahead, ma'am.
Okay, how y'all doing?
Very good, thank you.
Good. I have someone very special in my life that is a type 1 diabetic. And her blood sugar always all over the place. Take insulin often. And she feels that her kids, she always tells me, well, once you're a type 1 diabetic, you always a type 1 diabetic. My question is her case hopeless, or is it possible that if she takes these nutrients, she can move from a type 1 to a type 2? Is it possible?
No, I think, as you know, type 1 diabetes, insulin is a must because your body does not produce insulin, and without insulin, you can't use sugar. And so, but what can be done with micronutrient, that it can, because again, insulin also does it, and that in a body, type 1 diabetes also have high oxidative stress and chronic inflammation. By reducing it, it is possible. No data exists in human. It is possible. And you can consult with your doctor that the insulin, you have to have it, but insulin requirement, amount of insulin that you need may be reduced.
Okay.
But this is a possibility, and you can discuss with your doctor, but micronutrient would not hurt in any way the effectiveness of insulin, which is very important for type 1 diabetes.
Okay, thank you very much.
Thank you for your question. That's wonderful. We certainly appreciate your bringing that in. So, folks, there we have it.
Yes.
This has been, in my personal opinion, one of the most amazing discussions that we have ever had, and we owe a debt of gratitude and thanks to you, Dr. Prasad, for what you've shared with us today. So, for everyone in our audience, please understand something. What's been discussed here has been for information and educational purposes only. This is not intended to be a substitute for a visit to your primary health care professional. We strongly recommend that you seek the competent medical advice of professionals that you trust. Okay, the FDA has not evaluated these comments. Information and educational purposes only. Testimonials are purely anecdotal. What happens to one person may or may not happen to you, but the individuals who share their stories, believe them to be true, and we know them to be ethical and upright folks. So at this point, this is the end of our discussion for today, and we want to just go ahead and give you all an opportunity now to go ahead and feel free to unmute, and let's go. Thank Dr. Prasad for joining us, and we look forward to the next presentation. It'll be in about 2 weeks.
Let's go.
Thank you, Dr.
Thank you, Dr.